KwaZulu-Natal, one of the poorest provinces of South Africa. The government's promise to provide health care for everyone in rural areas like this is going to take time. The province only has one doctor for approximately every 4,000 people. Most rural people don't have access to primary health care. They never have a chance to see dentists, opticians, or even community nurses.
What attracted me about this train was that it was giving health care, affordable health care, to the rural people of South Africa. I am passionate about rural people. I am passionate because I know that those are the people who need most, and yet they are the ones who have very little. And because I don't complain, they tend to be forgotten. In many ways, I feel my whole training was centered to be used fully on this train. I think, how could I have been so lucky? Every bit of my learning was meant for the Phelophepa. From birth, I feel it just went round and round and round until I finally came to help the rural people of South Africa.
The time now is 10 minutes past 6 on this beautiful Thursday morning. This is not a bad dream, but this is your wake-up call.
Phelophepa means good, clean health. This train spends 9 months each year traveling to the most remote areas. Its role, to bring health services to places that the government's new policy still hasn't reached.
See, patients call this train a train of hope, a magic train, a train that is going to solve everything. And I think also when you have been wanting something for years, when something like this happens, you think it's going to solve all your problems. It doesn't, it can't.
Lynette went to England to specialize at a time when there were no opportunities for black women to take advanced training in South Africa. She opened the neurosurgical unit at London's Royal Free Hospital and went on to do a master's degree in counseling psychology.
We know you have got no money, we know you have got no transport, and this is why we're here, to support and help you. But unfortunately, we cannot see all of you. We quite appreciate that for a long time we haven't had these facilities. But we also know that we cannot see you after 8 o'clock. Even in our imagination, we never expect the numbers who come. If I tell you that the dental clinic or health clinic is full and you haven't got a sticker by that time, apologies, you'll have to go home. Now remember, I'm saying this to people who got up in the morning at 3 o'clock, 2 o'clock in the morning, walked for an hour, got a taxi which took them maybe to another 25 kilometers, walked another 5 kilometers, ran to the train. I see people running and falling coming to the train. And I think, my God, don't even run, because already it's full. All the clinics are full. The eye clinic is full. Apologies.
The only things that you can do, you can go home and then come
The best thing about working on the train is the challenge, meeting the different patients, and each community has its own dynamics. And the community people are human beings who are unpredictable.
He lost his ticket. Now he is crying because he lost his ticket. He does not know where the ticket is. And he's coming for us. Okay.
Okay.
There are 13 permanent staff living on the train, but it's the final year students from hospitals and universities who do most of the work and gain valuable practical experience in return.
The students are indispensable on the train. They're the people that do the real work. But they gain so much from the experience as well, both in life terms as well as professional terms. And to see the way they change over 2 weeks is just amazing. The discs look a little bit glaucomatous, so maybe that's the reason. There may be glaucoma here, that's the reason for that. And I think the students realize the value of their chosen profession, because it's very satisfying when somebody walks in being led or with a stick and can walk out of the train with a broad smile on their face for seeing for the first time for many, many years.
Yeah.
Right, use your bag.
Okay.
Put your glasses in there.
Okay.
Sevana izaqhubeka ke ngokindaba yaqala ke nanku systemic bale. I don't like children sleeping on the train like this, but they also have got eye problems. We couldn't see them in the morning. My problem is always having to balance it. If I force issues that the children are seeing in the eye clinic, it means also that the eye clinic people have to work even longer than perhaps 8 o'clock. And also it means one compromises professionalism, so one has to balance that.
We basically are a primary healthcare train, and we do a lot of health education and preventative measures. But it's so difficult, really. You talk to a rural person about a normal diet. What is a normal diet when they live on pap and vegetables, when there's no money, when there's no money for food? So sometimes it's so frustrating talking about what is normal. What is normal to me is definitely not normal to the people who deal with.
Excuse me? Well, we just finished a 10-hour shift and we're ready finishing our total for tomorrow. And when there were 10 other patients that had come from 20 kilometers away, were crying for treatment. They said they'd been here for 3 days and they weren't helped because they came too late. And I just felt that the least that we could do it, we'd only work an extra hour. So I asked my students if they were willing to just work that extra hour, and they were willing to sacrifice.
Are you coming to work? Jolly good. That's the spirit.
I feel that it's so amazing that they're willing to wait so long and so patiently. None of them really complain. So some of them have been living with this pain for so long, and I just feel that if we can help them, it's the best that we can do.
Rural people are poor, and I think for me, the worry, the concern is about the fact that we are faced with people who are not just faced with not having things, but even the weather ravages them. There seems to be so much that piles against them, and I think, my goodness, why do you deserve this?
Vugani, Vugani, Phelophepa, wakey, wakey. I don't know if you heard the birds at 5 o'clock. The birds were singing for you.
And if you look outside, the skies are absolutely beautiful and blue.
Is it because you are here to serve the people of the rural areas? And even as I speak, it seems to me the wind has been silent.
As well as the train's clinics, there are visits to local schools. Here, Sister Maggie and her students screen children and teach basic health care.
When I was first allocated to work in the rural clinics, I thought that it was a punishment because I felt that I had the expertise to work in the clinical situation. So it was by chance. And then I loved it.
The eardrum here is red, here there is wax. So when you look at the child, you look into the general appearance of the child, because you may have to refer the child now for other things. Look, for instance, this one has got scalp sores, has got ringworms, so you have to refer even for that, because this child was fortunate that you came to the clinic.
In rural areas, it's very difficult to explain to patients. So really, you must get a feel for your patient. Basically, when a patient's coming, it's like greeting the patient, letting the patient know that you are on their level. You know, you're standing here behind this counter here, and you've got this bar in front of you, and you need to bridge that gap. So basically, when you get your patient to smile, so the patient can, just also be in feeling with you.
So he will be back next year?
Yeah. We dispense generic medication, and community product like this, you need to get medicine also at a very cheap price, but you need to have quality as well. And quality is really where the pharmacist comes in. That's our role basically on the train.
The reality is that this train cannot run if patients don't contribute. We either have to think, do we want a train like this to run at affordable prices, or do we then want it to stop?
The train spends 5 days at each stop. On Saturdays, it travels to the next.
It's a challenge because you become involved with them, you bond with them. And now when the train leaves, you feel that at the same time you haven't done enough for them. The sad look in their eyes, their gestures when the train moves, showing you that I wanted to come for classes, but I didn't have money. It's a challenge, and then we always feel that we haven't done enough for them.
I was visiting South Africa, and then I heard about this train from one of the executives at Transnet. I thought, my God, what is going to happen? I must work on that train. So I still then applied. There's never been a woman who is manager on the train for a start, whether black or white. So I had to be taught as to how to do the hand signals, how to shunt the train, how to check the diesel, how to check pressure on the train.
So always, then it's two pieces, it's a sender. Then, we jiggle so right there.
The train started in 1994, January. It really was a nightmare, but a very nice nightmare. I didn't really have to ask any permission because the then government was busy preparing to leave and the new government really wasn't in place. That was a nice part. The not so nice part was Lily not being there.
Okay, and then I met Lynette, and somehow this woman was not what I had thought an African woman would be, and we just hit it.
No, I'm not scared.
The disadvantage I had growing up during the famous old South African system of apartheid, I never had the opportunity to know black people, never. And Lillian is my first black friend, but she's not black, she's Lillian, she's my friend.
I've got 3 children of my own and 2 adopted ones. When this challenge came, I discussed this with them, and then they said to me, "Mommy, do you want to take the job?" And then I said, "Yeah, but I can't take it. I'm afraid of leaving you." And then they said, "If you want the job, take it." I managed to talk to them over the phone sometimes. Sometimes I have to scold them for doing nonsensical things at home. When the eldest reports them, I have to act on the phone and pretend as if I am there.
The interpreters are late. Perhaps in another 10 minutes, I'll bring them down. If you're lucky. I think I get my strength from knowing why it's so vital that this train continues. This train must not stop. And I also know that I have got to be strong, for the staff to be strong, for the students to be strong, for the patients to also be strong. So somehow I have to continuously keep this up. I know that the communities we visit call this a train that gives them vision in various ways, and so it does. But I also know that we have got our limitations. The reality is that the need in South Africa is enormous. It's been a need for so many, many years that whatever we put is only a drop in the ocean. But again, my belief is that an ocean is made out of drops.
We're like a big family, and as you know, in families we do get to fight, and in a small space like this you get to see the person that you fight with 5 seconds ago. The whole day you sit with him at breakfast, lunch and supper. So it gets to you, but you know, we're all professionals, and I think the respect that we have for each other is really nice because we can work out things, we can talk about things.
It's something I could do when I finish my course.
One learns that actually we are a multi-professional team and that we're not functioning as individuals or as one profession on its own. So it's nice seeing that we actually need each other to interact and function in proper nursing or proper healthcare for all patients.
Well, the living conditions are not exactly what one would want. I've always liked space, but if I can't have space, it doesn't really matter. The 3 things I missed, I said a big bed, a bath, and going to the theater. Lynette said, I can't do anything about your theater, not much about the bed, but I can try something about the bath. And I got my bath, and it's written only, as you can see, and there are no compromises here. This is my bath, and it's mine only. You are free to photograph this bath. After a hard day's work, I come here, I soak, I think, I reflect, I feel better. Good morning, I'm coming just now. I expect you also to treat each patient with dignity and respect. I don't want you to shout at them. Because most of the patients have been shouted all their lives, and the last thing I want is for you to be shouting at them.
People from local communities receive basic health training at each stop. Before the train leaves, they get a certificate and a healthcare manual.
Good. Right.
This year, Phelophepa staff have seen over 100,000 people.
Good. Then can come
It was just that, like, your one lens was a bit thicker than the other, so I had a bit of a problem. But as long as you can see with them now, what I'll do, I'll just...
As long as you can tell me if you are married. I've got 3 sons who are looking for me.
You're embarrassing me.
Okay, thanks. When people are sick, the hospital is miles away from this place. The clinic, we have got no clinic here. I think it came at the right time, when people need it.
Until South Africa's dream of healthcare for everyone comes true, Phelophepa will go on providing services and hope for rural people.
This train is about working together, but for me, it is actually like a mini South Africa, a new South Africa, where men and women come together to give their best to build South Africa. Because I find, to my disappointment and sometimes absolute anger, people say, why don't they do this? Why don't they do this? Who is they? The majority of people in South Africa must themselves do something, because they is me and whoever is in South Africa.
To learn and clicks, there are visitors to schools.